Hello, it's Mr. Carroll here with my first video in my series on public health and pandemics. So today we're going to be talking about the origins of public health and this idea of what is public health. So let's get started. First, we got to understand how people thought you got sick. Now, for a long time, there was this idea of four humors, which people might have that being imbalanced, and the most common way to get yourself back in balance was to bleed people a little bit to kind of let out, to kind of get the bloods back in balance. They also had this idea that there was miasma, or bad air, which would cause illness. All right, they thought that breathing in swamp air or air around dead bodies or a battlefield would cause illness. We know that ancient Romans and ancient Chinese talk about it in their texts. They talk about putting cities away from swamps where you can get good air to flow through the city so you wouldn't get that bad air kind of stagnating. For example, in the 19th century in London, the River Thames was full of sewage and it just smelled bad. And so people thought, well, if you smell the bad water, it's what's going to get you sick, not if you drink it. Well, then we have this doctor, John Snow. He's Queen Victoria's personal doctor, right? And he's starting to think about that it's not the vapor, not the air, but something in the water that is causing people to get sick, something that he couldn't see. And this is what is known today as germ theory. Now, of course, it has its origins in Roman writing and Vedic India and Islamic Persia, but they all just kind of said stuff and they didn't really have the proof for it, right? There's this ancient Roman writer Lucretius that says there's really, really small things that exist, but he had no way to prove it, all right? There's the Greek historian Thucydides who talks about how disease is probably being passed by touching people and not necessarily by breathing the air. But again, no proof. Up until this point with John Snow, he's starting to think like there's got to be some way to prove it. And of course, people don't buy into it. They think he's crazy for suggesting it. Well, in 1854, at Broad Street, there was a cholera outbreak. Now, cholera is a digestive issue. It causes a lot of pain in your stomach. It causes a lot of diarrhea. It's from drinking diseases that live in bad water. Okay, it specifically comes from India, but we'll talk about that more at another point in time. And in 1854 in London, people would pay to get water from different pumps, and different pumps have different sources of water. All right, and so where you drank your water from would kind of influence how your health would be. And so Dr. Snow started going from door to door asking which pump people used. And he created a map you can see here on the left-hand side of the screen. And he put dots and he said, which pump are you drinking from, who's got cholera, and he kind of mapped which pump. He started to notice a pattern. And this is an early form of contact tracing, which is something that we're going to be talking about later on. But just kind of keep that in mind. And he coded the map, and he found that a lot of illnesses originated from one pump. Remember how I said different pumps have different water sources? Well, this one pump had a contaminated water source. All right, it had the cholera bacteria, it had the cholera disease in there, and that anyone who drank that had a higher chance of getting cholera. So then we get to this idea of epidemiology. Dr. Snow thinks something is in the water that's causing the illness, in this pump specifically, and he has the pump handle removed. And you can bet people were angry. The water company who owned the pump lost money. Other people had to walk further, and no one understood why, because everyone believes in this miasma idea. Like, they're like, we're not breathing the bad air, we're just drinking water from this water pump. Why can't we drink our water? Why do we have to walk further? But after the fact, there was a noticeable reduction in sickness from cholera once this pump handle had been removed. And the pump is still there without its handle. You can see it in the lower right-hand side of the screen. And so epidemiology is the study of diseases, and but it's not just studying them. You can't just study the diseases. And you can't just treat individual patients. You have to collect data and you have to act on it, even when you're going to make people angry, because it's going to be for their better health in the long run. And so that epidemiology kind of is the start of this idea of public health. And public health is a term we use when we look at health at a population level, right? So a doctor is taking care of your individual health, and he's going to treat your, say, cholera disease. But public health is going to look at the whole system, at everything there, the food people are eating, the laws that are passed, the sicknesses that we're seeing, and they're going to look at what's going on and act on it to try and help stir population health. So while the doctor might be treating your cholera and your neighbor's cholera and your friend's cholera and taking care of you individually, public health officials are going to look and be like, interesting, all this cholera is coming from one pump. What if we just remove the pump handle and then nobody can drink the bad water and then nobody else is going to get sick and we don't need to get all the other doctors involved in this one disease. And so that's what public health is. So there's your short overview of the history and the origin of public health. All right. If you have any comments, feel free to leave them below. If you like the video, don't forget to hit the like button. Thank you to UCLA for those great cartoons that were shared in a lot of the slides. I look forward to you guys coming back and watching my next video on public health and pandemics.